Hi, and welcome to this webinar about student health insurance at LIM College. The purpose of this webinar is to give you information on how to use your student health insurance here at the college, how to access your insurance card, what to do when you need to go to the doctor, when you get a prescription, how to file a claim, as well as to introduce you to some of the common language that you might hear around health insurance here in the United States. So to begin with, as I mentioned, there will be some terminology throughout the presentation that is specific to the field of insurance. These words include things like copay, in-network provider, deductible, urgent care clinic, claim, explanation of benefits, or EOB. If you're not sure of the definition of one of these words, you can always refer to the NAFSA medical insurance brochure, which you should have gotten at International Student Orientation, or you can always reach out to one of the Office of International Student Services staff members for clarification. But again, this presentation will hopefully help clear up the definitions of most of these words. So all students at LIM College are automatically enrolled in the college's health insurance plan. The company that runs the college's plan is called Gallagher Student. Students do have the option of opting out or weaving out of this plan and finding another health insurance plan to cover them while they're here at the college, but we strongly encourage international students not to do so. One of the reasons why is that we have had cases before where students have said to themselves, I don't want to pay for this plan, I can find something that's more affordable on my own, and so they opt out of the college's Gallagher Student Health Insurance and find another plan, usually online, which may cost less than the Gallagher plan. However, those plans often cost less because they cover fewer things, or are just in general more expensive to use. Healthcare in the United States is very expensive, and we want to make sure that you are covered by an insurance plan that is of a high quality, so that you don't find yourself sick or injured in need of medical care for some reason, but without a plan that's really going to cover you well. However, if you do find a plan that you like and you'd like to use it instead of the college's Gallagher Student Insurance, please make sure that you submit the decision form, which you would submit online prior to January 31st, 2019. That's the deadline to do so. You can find a link to this online form that you'll need to submit on the college's website, or if you just Google LIM College Health Insurance, it'll take you to that page. So here is the main page of information about the college's health insurance plan. You can access it by going to www.gallagherstudent.com/LIM, and as you can see, there's information about what the plan covers, and this is also where you can log into your health insurance account if you do hold the college's insurance plan. So it's a bit complicated because there are actually two companies involved with LIM's health insurance plan. Gallagher Student Health and Special Risk, which is the one I've been talking about so far, is really the customer service company. So they can do things like answer questions about coverage, help you find a doctor, give you clarification on which services are covered, things like that. But the company that actually provides the insurance is called Commercial Travelers Insurance Company. So they're the ones that provide your card. If you need to file an insurance claim, it would go to them. And your prescription medication coverage is also through them. Here in the States, you can show that you're covered by a health insurance plan by showing your health insurance card. It's a document that demonstrates to doctors and pharmacies what type of insurance you have. If you don't have your health insurance card on you when you go to see a doctor or when you go to a pharmacy, you might be asked to pay for the full cost of the visit because without the card, there's no proof that you are covered. This cost can be in the hundreds of dollars or even more, depending on what sort of procedure you're getting or what sort of medication you're getting. So you really want to make sure that you carry your insurance card with you wherever you go, so that you do have it on you, even in case of emergencies, which, as we know, can strike at any time. This is what your insurance card looks like through the college's health insurance plan. So as you can see, it's got a front and a back. And it contains various information on it, which is useful to doctors or pharmacies who need to determine what sort of plan you're covered by when you go to see them. You can access your insurance card by going to gallagherstudent.com/LIM. You'd click on Account Home in the left toolbar. If you've never logged in before, you'll need to create an account in order to log in. And then once you are logged in, under the My Account link, you can click on Authorize Account. You'll enter your student ID number, which you can find on your student ID card, and your birth date, and then click on Authorize Account. And that will redirect you to the account homepage, where you can click on Generate ID Card under the Coverage History section. I strongly recommend that you save a picture of your card to your computer and your phone so that you have a digital copy that you can pull up at any time. You can also, through the online system, request a hard copy card be mailed to you. Just make sure that you've updated your address in Sonus, because that's where the card will get mailed to. And to reiterate, again, make sure that your address is correct both within Sonus and within your Gallagher account, because down the road, even if you don't request an insurance card, if they need to send you any documents, claims, refunds, anything along those lines, they'll send it to the address that they have on file. So you want to make sure that that is updated and correct. So you are all set, you've got your insurance card, but you get sick, you need to go to the doctor. What do you do now? Well, before we can talk about that, we need to explain another common term, which is a network. A network is a group of approved medical providers, which could be doctors, therapists, surgeons, as well as offices, hospitals, clinics, etc. Each insurance plan has a network or a group of approved providers who have agreed that they will accept a given insurance plan. So in your case, you want to search for a medical provider who is a, quote, a preferred provider, meaning that they're part of the insurance company's network. Doing so means that your insurance will pay a larger part of your medical costs. If you do not go to a preferred provider, you're going to somebody who is out of network, you risk having to pay more of the medical costs, a greater share, or even all of the medical costs. So obviously something that you want to avoid if possible. The network for the Gallagher Student Insurance, if you're in New York, it is PHCS, MagnaCare Preferred Provider. If you're in another state in the US, it is the Multi-Plan Preferred Provider Network. So you want to keep those things in mind. They also appear on your insurance card, so you don't necessarily need to memorize those things. So you might be saying to yourself, well, I need to go see a doctor. How the heck do I know if a given provider or given doctor is a preferred provider? You can do so by going to gallagherstudent.com/LIM again. In that left-hand toolbar, you can click Find a Doctor, and then the button that says Search for a Provider. You'll be redirected to the MagnaCare page, and you can use their search features under Find a Healthcare Provider to find someone that accepts the MagnaCare PPO plan. You can also use that search to narrow down the types of doctors that you're looking for. So whether they're general practitioners or specialists, you can really narrow that down, as well as by location. You can also use other services to help you find doctors. So one that I personally use is called ZocDoc. You can find it online at www.zocdoc.com. They also have an app. You can use ZocDoc to, again, search for providers who accept certain insurance plans and also to make appointments, but it is strongly encouraged that you're still calling the office of the provider that you want to make an appointment with before you make your appointment, just to double check that they do accept your insurance. You don't want to trust ZocDoc because occasionally their records will not be updated or they'll be incorrect. So you want to make sure that the provider you're seeing accepts your insurance before you go to your appointment. So what's covered by the LIM College Student Plan? Medical services provided by a preferred provider, again, a provider that is in network, are the most affordable option. So you could go to urgent care, see a general practitioner, go to a gastroenterologist, a dermatologist, or other doctors. Those kinds of things would fall under this category of medical services. You can also find more information on the insurance webpage that we've mentioned a few times to see exactly what services are covered under the plan and which are not covered or which are excluded. In addition to medical services, preventative care is also covered. This includes things like an annual physical exam, routine screenings, most of your immunizations, and women's wellness or OBGYN visits. So if you do need to make those kinds of visits or appointments, those are also typically covered by your plan. So when you go to see the doctor, there will be certain costs that you'll need to pay. The first is a deductible. A deductible is the amount that you have to pay before your insurance plan will pay anything. Almost all insurance plans have some sort of deductible. The deductible for the LIM College Plan is $300 a year, which means that you need to pay $300 for covered services in 1 year before your insurance plan will pay part of the cost. Once you've paid $300 in medical costs, you still are required to pay a small fee every time you go to the doctor, and this is called coinsurance or a copay. You typically have to pay your coinsurance at the time that you go for your visit. If you see an in-network doctor, your insurance will cover the rest of the cost outside the cost of the coinsurance automatically. And again, just remember that you need to bring your insurance card with you so that the doctor's office knows how much to charge you for your coinsurance and that they'll be covering you for the rest of the cost of your visit. If there's additional costs that you have to pay, your doctor will typically send you something in the mail or call you later to let you know that you owe an additional payment. It's worth noting that the deductible is $300 for any medical cost. So it does not mean $300 per doctor that you go to see. So for example, maybe I need to go to see a gastroenterologist in January and my visit costs $200 altogether. I would be responsible to pay the full $200 because that's less than my total deductible. But say in February, I need to go to see a general practitioner, which also costs $200. Since I've already paid $200, I would need to pay $100 more towards the cost of that visit to meet my deductible. But after that point, the insurance plan would pay the remaining $100. And if I need to go see another doctor later in the year, I've already met my deductible, so I would not have to cover that cost anymore. So it's for all medical expenses and it's within 1 calendar year. Going back to coinsurance, again, that's that small fee that you need to pay each time you attend a visit. For a normal doctor's office visit, it's $10. For an emergency room visit, it is $150. So if you've gone to the doctor and they have prescribed medication to you, prescription medicine and prescription birth control are covered under your insurance plan. So if your doctor thinks that you need to take medication, they will give you a prescription which is sent automatically to the pharmacy of your choice. So it's a good idea to know before you go to the doctor a pharmacy that's close to where you live so that you can pick that up on your way home. You have a copay for medication. This would usually be $15 per prescription, but depending on the type of medication, it could be $35 or $75 per prescription. Make sure that you are bringing your insurance ID card with you to the pharmacy so that you're charged the correct amount, just the copay, and not the full cost of the medication, which can be quite high. And it's also worth noting that if For medication and birth control that you do not need a prescription for, this is not covered by your insurance plan. So you're responsible for the full cost of any medication that does not need a prescription. Medication that does not need a prescription is often called over-the-counter or OTC medication here in the States. So some common pharmacies here in New York, ones that you've probably seen on pretty much every corner, include CVS, Duane Reade, and Walgreens. And you can do a simple Google search to find a pharmacy that's close to you. And again, you do want to make sure that you know the address of that pharmacy so that you can provide it to your doctor's office if they need to prescribe you medication. LAM College's student health insurance does not cover dental and vision services. There is optional dental insurance available through Gallagher by going to the link here in the presentation. And the plan does offer various discounts on dental and vision services. And there's another plan there that provides more information on that. It's just important to know that that is not insurance. But if you opt to use those services, you can get more affordable dental and vision care. If you're sick or injured, you might be saying to yourself, I don't know where I am supposed to go to get care. So we've got kind of a helpful breakdown for you here. One thing to make note of is that LIM does not have an on-campus health services office. So if you're sick or injured, you need to use off-campus resources. We do have an on-campus Office of Counseling and Accessibility Services, which is free to all students for mental health counseling. They have licensed psychologists on staff who are trained to assist with mental health concerns like depression, anxiety, personal issues. So you can access counseling through that office, which we strongly recommend if you're feeling like you're dealing with issues like that. But that office does not have medical professionals in the sense of if you get a cut or you think you have an infection, they cannot help you. So you can go, however, to these off-campus places: urgent care, primary care, hospital emergency room, or specialists. So first and foremost, an urgent care clinic is typically very convenient and less expensive than a hospital emergency room. Some are open 24 hours a day. Most will work with your insurance plan. But again, it's important to check in advance by calling them. You also typically do not need to make an appointment at an urgent care clinic before you go. You can just walk in to see somebody, which is often quite helpful if you're not feeling well. Another option is a primary care doctor, which is a doctor that just helps with everyday medical care. You do typically need to make an appointment before you can see a primary care doctor. So it's a good idea to do research and make sure that you found a doctor that accepts your insurance plan, and then call their office to make an appointment. You can also go to the hospital emergency room for care. This is for very serious emergencies only. It's a good idea to know which hospitals are nearest to where you live and nearest to campus, as well as how to get there. But if you're alone and you can't transport yourself, or if you're experiencing a really extreme emergency, you can call 911. They can send out paramedics and ambulance to come and get you. And as you probably know, 911 is also the number that you can call for fire services, the police. It's the general emergency number here in the States. And then finally, other types of doctors that you could go to include dentists, optometrists, dermatologists, gastroenterologists, etc., which would be specialists. So here's a handy flow chart. If you have a minor illness or injury like a cold, cough, sore throat, flu, fever, minor cut, sprain, rash, we recommend going to an urgent care center. Some brands include CityMD and MedBrite Urgent Care, or to a local doctor, which is a primary care, often a primary care doctor or a specialist, depending on what issue you're dealing with. If you have a major emergency, and that can include things like a head injury, severe shortness of breath, loss of consciousness, bleeding that doesn't stop after applying pressure for at least 10 minutes, those would be cases when you would want to go to the emergency room. And again, if you're experiencing a life-threatening issue, you do want to call 911. One of the reasons why you want to be sure that you're choosing the correct venue if you do need care is for cost. So we mentioned a few slides ago that visiting a normal doctor's office is a $10 copay, whereas visiting an emergency room is a $150 copay. So, of course, if you are experiencing a serious emergency, you want to make sure that you are getting the care that you need, and going to the emergency room is a good idea. But if it's something minor, to save yourself money and time and a headache, it's a good idea to avoid the emergency room unless absolutely necessary. Okay, so you have visited the doctor, you're feeling much better, but what happens next with regards to your insurance? So you'll receive an explanation of benefits in the mail from your insurance company. This document shows you the total cost of your visit and breaks down who paid what. So what portion of the total cost did you pay? What portion did your insurance pay? Sometimes the doctor's office will have a discount on the overall cost, so that will be noted as well. It's important that you know that an explanation of benefits document is not a bill. It's just an explanation. So if you owe additional payment, you'll get a bill directly from the doctor's office or hospital, also in the mail. Explanation of benefits documents can be sometimes quite scary to look at because they can show cost of visits that are very high. But even if it seems like there's a portion of the visit cost that's not accounted for, it doesn't necessarily mean that you're responsible for paying it. So again, you should hold on to these explanation of benefits documents for your records, but you should wait for an actual bill before you try to make payment to anybody. If you get an EOB document and you're not sure how to interpret it, you can contact Gallagher Student for help, or Mr. Kevin Shiner, who's our insurance specialist on campus. He works in Student Financial Services, and we'll give you his contact information at the end of this presentation. Sometimes when you go to the doctor's office, they may require that you pay the full cost of your visit up front, meaning that they will not, kind of take your insurance into account. If this happens, you can file a claim with the insurance company after your visit. And if your claim is successful, the insurance company will pay you for the cost of the visit. To do so, you would need to submit a claims form and the bill or a receipt to Commercial Travelers Insurance. Again, just as a reminder, that's the company that's actually providing your insurance coverage through Gallagher Student. And you can contact, again, Mr. Kevin Shiner if you have questions about this process or what you need to submit. So here is the important contact information that you'll need. For questions about enrollment, coverage, or ID cards, you can contact Gallagher Student directly, and then there's their contact information. For questions about benefits, claims, and claims payments, as long as you've submitted them on or after January 31st, you can contact Commercial Travelers, and there's their contact information. And again, Mr. Kevin Shiner is the Associate Director of Student Accounts and also our insurance specialist on campus. So you can call him at 212-310-0641, or you can email him at kshiner@limcollege.edu. So that is everything. I hope that helped to answer some of your questions about health insurance. Please feel free to come back to this video anytime that you need to use your plan, if you need a refresher on some of the vocabulary or processes. Or as always, you can reach out to Mr. Shiner or the International Student Services team for help with your insurance. Have a great year.